stopped ordering things online, and she stopped hanging up pictures, and she started putting away her clothes and kind of giving things away because she thought she was going to die. So she's like, I don't need any of this more. Quote unquote, she said, my wow, I totally um, everything's out the window. Everything's done for her basically. Um, and to me, that was really kind of an important piece to understand because I knew that she was just kind of going through an episode where she felt uncomfortable that someone told her she was going to die, and it did turn out that she got over that, and she's now back to ordering things online and just being her happy self. So also when doing social work practice, there are a lot of theories that go along with um, situations. So the main 2 points that I saw, or the main 2 theories that I saw when I was interning this year, was person in environment and relationship based approach. So the person in environment approach, that means that paying attention to what their behavior in their environment, what's in their environment, how things around them make them feel. So this becomes a big part in my clinical notes, kind of observing the room, observing the patient, seeing how they act in their environment, and if maybe a different setting would make them happier and more comfortable. It's really important to pay attention to. And then the relationship-based approach is just building a relationship with somebody in general is important, especially to someone who is at the end of life. It shows that you care and that it's not just something you have to do. You want to be there for them. And then again, having relationships with my staff members, employees, because talking to one another really it helps, and I get great feedback from them sometimes. So yeah, building a relationship was very critical this year in my internship. Um, and then as far as support and I guess self-care, for me, my seminar class and my supervision, I felt like those were my most supports for learning. And in my seminar, I really liked being able to talk to my other social work majors about what I did in agency that day, because sometimes there were just situations where I didn't know what to do, or for example, I wasn't sure of really what an intervention was, so I brought it up in my seminar class, and I had some students give me some ideas of interventions to do with clients, and it turned out that the one client I saw right after I talked about the interventions, he had liked dogs, so I printed out a couple dog poems, and when I got to his nursing home, Silver Creek in Bristol County, he was sleeping, so I read him the poems while he's sleeping. He doesn't have to be awake. It's just comforting for him to know that somebody cares and recognizes that he likes dogs. So I think that had an effect on him, even though he was asleep for the entire time I was there. And then as far as supervision goes, I really liked having support from my supervisor, Kathleen. She always thought my questions were great, and she always answered my questions truthfully and in length. And that really kind of helped me to be able to understand social work better, not just in the agency, but kind of on a state level too. Like for example, Trump was thinking about revoking one of the Healthcare Act, and I had brought that up, and I asked like how that's going to affect the agency, or even statewide, but particularly the agency. and she had given me some great feedback, and if something was to change, then this is what I would be doing to adjust to that change. And I think I really also kind of supported her too through the process of getting a new computer system at the agency. I was able to help with the technology and be able to give her some free time to be able to work and work and go through trainings in order to get that technology down, because it is really important for social workers, CNAs, nurses, anybody who goes out as they have to use this computer system on their visit to kind of evaluate and do check-ins for patients. So it was important to learn that. I'm really happy with my placement this year. I learned a lot, and I hope next year is even better. Thank you. Done.